Grand Nursing Theory, Imogene King, presented by Deshara James, Lindsay Baer, Jessica Orr, and Rickiara Washington. Imogene Eva Martina King was born on January 30th, 1923 in West Point, Iowa, to Daniel King and Mamie Schroeder. She was the sister to Stanley Lawrence King and Mercedes Mary King. Imogene describes her life in a small town as being ideal up until financial troubles fell on the family, leading to her extended family members taking interest in her well-being. Her uncle suggested she attend nursing school after she finished high school. Imogene notes that her ambitions of wanting to become a teacher and get married were shadowed by an unintentional path into nursing. This slide shows her birth certificate from 1923 in the state of Iowa. Here are some pictures of Imogene growing up alongside pictures of her family. Imogene's education. She received her nursing diploma in 1945 from St. John's Hospital School of Nursing. She then went on to receive her bachelor's degree in 1948 and a master's degree in nursing education in 1957 from St. Louis University. Finally, she received her doctorate in education from Teachers College of Columbia University in 1961. Imogene King is regarded for being a pioneer in nursing theory development. She began developing her theory of goal attainment conceptual framework for nursing in the 1960s. Her first published theory approach article graced the pages of the Journal of Nursing Science in 1964. Her book, Toward a Theory of Nursing, General Concepts of Human Behavior, was published in 1971. The completed theory, A Theory for Nursing Systems, Concepts, Process, was published in 1981. During this time, she worked as a professor at Loyola University in Chicago. The U.S. Department of Health, Education, and Welfare. She worked as an assistant chief of the Division of Nursing Research, Grants Branch. She also was the principal of the nursing school for the Ohio State University in Columbus, Ohio, and she was a professor at South Florida College of Nursing, where she retired from in 1990. She attained many awards and honors over her lifetime for her contributions to the body of nursing knowledge and development. Philosophical underpinnings of Imogene King's theory of goal attainment. Worldview. King wrote the theory for goal attainment in 1980. King's theory was first introduced in the 1960s and was influenced by the evolving healthcare system in the U.S. at that time. Post-World War II, educators suggested removing nursing education from its vocational aspect within hospital training schools and promoted higher education for nurses and institutions. An increase in federal funding to support nursing education became available in the 1960s and introduced the restructuring of nursing education programs into bachelor degrees. By 1960, 172 college nursing programs awarded Bachelors of Science in Nursing degrees. These nurses would now have a well-rounded education to serve the complex needs of patients and advance their roles in healthcare. This comprehensive nursing education elevated nursing at this time into skills that were holistic for their assessments, and their interpretation of feedback increased with the nurse-patient relationship. King developed her theory at this pivotal time in nursing when the scope of nursing practice was evolving. Perceiving the patient in a holistic way enhanced the ability to care for them. King's theory of holistic nursing influenced effective and therapeutic communication between nurses and their patients. Holistic approaches to nursing care improved assessment skills and resulted in a therapeutic nurse-patient relationship. Inspiration for King's theory began with Ludwig von Bertalanffy's general systems model. This model provided a basis for understanding the constant unification of science and ideology. His background was in philosophy, history of arts, and biology. His model helps to understand how a system works or behaves, how one must understand its parts, and how they are all connected. According to von Bertalanffy, a systems approach must be applied to understand life. This model presented a reorientation of the worldview and influenced nursing to develop a holistic approach to patient care by viewing patients as systems. Systems are comprised of many elements that make it whole. Each element should be considered to understand how it works, thus understanding how we can effectively treat patients, as King developed. Philosophy reflected in King's work. The basis for King's work was inspired by Bertalanffy's general systems model. King suggested that the science of this model represents holism, and the multidimensional role of nurses could be studied as an organized whole. The general systems model influences a view of systems, understanding their interactions to work together to reach a common goal. It emphasizes interactions between the nurse and the patient, and it influenced King to view the patient as a whole to fulfill therapeutic nurse-patient interactions and develop interventions that address all patients' needs. Here is a diagram of Imogene King's theory of goal attainment through process of interaction. The process of interactions to gain transactions. King's theory focused on helping others attain goals. First, there would be an action followed by a reaction. It would lead to the interaction of nurse and patient, followed by the goal outcome achieved together. Imogene King believed that nursing is the care of human beings interacting with their environment. The goal attainment theory influenced by the general systems model. Nurses consider emotional, spiritual, and ethical components of the patient system, in addition to the physical and physiological components of the system. Nurses understand the patient as a whole, and they care for patients holistically. The patient is viewed as social, rational, reactive, dignified, and purposeful. Perceptions of the nurse and client influence their interaction process. Interaction process influences success of outcomes. Goals and values of the patient should be considered to enhance the nurse-patient relationships. This recognizes that individuals have a right to knowledge and participation in decisions related to their health. They have the right to reject or accept care. Patients are dignified through nursing care, and nurses are there to support them and to listen to them. Nurses and patients cope together regarding situational events. Nurses help patients to attain, maintain, and restore health through their relationship and goal of healing through advocacy. Theory analysis. Theory of goal attainment. It emphasizes the importance of nurse-patient collaboration. It focuses on mutual goal setting and achievement. It's comprised of 3 interacting systems. These systems are personal, interpersonal, and social. Personal represents the individual perception and understanding. Interpersonal represents nurse and patient contribution to goal setting. And social encompasses resources to support goal achievement. Theory of goal attainment. Effective communication is pivotal. Nurses must employ active listening and skills for positive patient outcomes. Nurses' understanding of patients' viewpoints can establish realistic and attainable goals to help align with the values and preferences of patients. Within this theory, there is a concept of therapeutic relationships that are characterized by trust, respect, empathy, and genuineness. Nurse incorporation of patients' values and beliefs into the goal-setting process will lead to increased likelihood of goal attainment. Imogene King's theory of goal attainment focuses on meaningful interaction, communication, and goal setting in nursing. These elements are critical for rapid yet effective patient care in emergency crisis, for example. Establishing strong nurse-patient relationships improves outcomes through quick, goal-oriented interventions. The theory is adaptable to high-stress, time-sensitive environments. The value of extending nursing science to emergency crisis. Imogene King worked to achieve the evolution of nursing science through theoretical frameworks that enhance clinical practice. King's theory helps prioritize and adapt to goals in high pressure and high stressful situations. King's theory helps to improve and enhance the ability to manage complex, time-sensitive emergencies. Balances rapid decision-making with patient care and by supporting personalized care despite high patient turnover and constant constraints. Examples of real-world applications can be found in these emergency settings. Mid-range theory in emergency crisis. Imogene King focused on dynamic nurse-patient relationships. King's main concepts and components of the theory are perception, understanding patients' needs, urgency, and context quickly, communication, effective information exchange under pressure, clarity in instructions, and providing information to make decisions, goal setting, collaborating on attainable health outcomes, supports rapid yet thoughtful decision-making in emergencies and helps aid clinical judgments, case studies or anecdotal evidence of its effectiveness. Relationship of grand theory of emergency crisis. Mid-range theory is a practical extension of grand nursing theories with structured interactions. It provides structure for nurse-patient interactions during emergency crisis. It emphasizes balance amongst holistic care in chaotic and urgent environments and provides stabilization and recovery. It encourages maintaining human dignity despite chaotic environments. Meta-paradigm concepts in emergency nursing. Through nursing, collaborative goal attainment process with the patient to achieve desired health outcomes. With health, dynamic state influenced by ever-changing interactions, crises, and care quality. With the patient, active participation in goal setting in highly stressful situations as needed, and an environment, external and internal factors impacting emergencies, including stressors and resource availability. Usefulness of this theory. It enhances nursing education. It served as a framework at Ohio State University School of Nursing and determined the content taught at each level of the nursing program there. It's used in nursing education programs such as in Sweden, Portugal, Canada, and Japan. Its usefulness. Organizing guide for nursing practice. Examples. These authors used King's theory of goal attainment to study telenursing, which utilized technology that involves smartphones, cell phones, video conferencing, and remote patient monitoring to provide real-time monitoring of patients in their homes. This technology allows nurses to act promptly, which results in prompt and efficient care to individuals outside of hospitals. Case study. Robert, a 49-year-old man, was recently diagnosed with hypertension. His physician, Dr. Barkley, introduced him to goal setting to help manage his high blood pressure, focusing on dietary changes, exercise, and medication adherence. Robert expressed concerns about managing his health due to his busy work schedule as a small business owner, but he was committed to improving his well-being. Application of goal attainment theory. Dr. Barkley assessed Robert's knowledge, readiness to learn, and habits contributing to hypertension. Through this communication, Robert and Dr. Barkley established a major health goal: improve Robert's diet and exercise routine. Dr. Barkley set realistic goals for Robert to attain. They agreed that Robert would incorporate low-sodium alternatives within his diet, as well as exercise for 30 minutes, 3 to 4 times a week. Robert committed to taking his hypertension medication daily. Robert gradually incorporated healthier foods into his diet, as well as using other alternatives like dash seasoning to season his food with. He committed to exercising for 30 minutes each morning before work. Dr. Barkley provided educational resources to Robert to help manage his hypertension throughout this process. After 6 weeks, Dr. Barkley and Robert assessed the progress of his new health regimen. Robert reported feeling less dizzy, more energetic, and no more headaches. Robert's blood pressure had improved slightly compared to his last visit. Robert felt empowered in his self-management. Dr. Barkley and Robert set more goals to help contribute to a more manageable blood pressure. The new goal focused on reducing his blood pressure levels by 10 to 20 millimeters of mercury, systolic and diastolic, over the next 12 weeks. Testability. The study was led by these authors, which applied Imogene King's theory in the exploration of goal attainment, allowed to MS patients to achieve their prioritized goals and improve the quality of life and in instrumental activities of daily living. The study was related to patients' active participation in mutual goal setting and nurse-patient interaction. The effect of applying the nursing process based on the theory of goal attainment on activities of daily living and the quality of life in persons with multiple sclerosis during COVID-19 pandemic, a clinical trial. The purpose of this study aimed to determine the effects of applying the nursing process based on King's theory of goal attainment on activities of daily living and the quality of life of people with MS during the COVID-19 pandemic. With this study, the methods were: in the clinical trial, 70 patients were recruited using the convenience sampling methods and randomly assigned into 2 groups. A 4-stage theory of goal attainment was developed and implemented for the intervention group for 30 days. Data was gathered by the ADL and the QOL questionnaires, as well as the goal of attainment scale before and 2 months after the intervention. Results. The intervention group received higher numbers of prioritized goals and reported higher and instrumental questionnaires than the control group. Conclusions. Based on the results, the theory of goal attainment could effectively promote mutual goal attainment for people with multiple sclerosis during the COVID-19 pandemic. Application of theory. The nursing process based on the theory of goal attainment consisted of 4 stages. The assessment stage. King's evaluation form was developed according to literature. Face-to-face interviews were conducted to complete the questionnaires. This established perception, communication, and interaction with the patients and collected health history, physical examinations, and their profile. Planning. Identified goals were shared with the intervention group based on the nurse-patient interaction. Patients were requested to determine the chronological order of attaining goals. Once the patient's approval was established, the goals were prioritized. Implementation. The nursing procedures were implemented through the nurse-patient interaction. Follow-up sessions took place for 4 consecutive weeks by phone for 20 to 45 minutes and on social networks based on the patient's needs and desires. At the end of the stage, educational content was provided to patients. Evaluation. The evaluation was performed based on the goals that were set. The rate of goal attainment was scored based on the goal attainment scale criteria. In conclusion, Imogene King's theory of goal attainment offers critical insights for emergency nursing and provides crucial insights for emergency nursing, as well as nursing in general. It enhances outcomes with communication and goal attainment by sharing goals. It supports holistic, respectful, and patient-centered care in emergency care crises and, generally speaking, in the nursing profession. It enhances patient outcomes even under high-stress, time-sensitive conditions. References.